Are you experiencing back pain that you can't get rid of? Getting migraines, vertigo, having trouble sleeping, and/or brain fog? Do you feel like your medical doctor doesn't understand your condition? Blair Chiropractic might be the solution you've been looking for. If you've ever been skeptical about this, the two doctors you're about to listen to were even more skeptical than you were when they looked into chiropractic work. But fear not. Get expert guidance from the blonde and the bald, Doctors Beth Bagley and Schurger. These two doctors have extensive experience beyond the healthcare realm and bringing unique vision and healing to their patients. What do you have when you get a biological analyst and an engineer together? Find out right here on another episode of The Blonde and the Bald. Welcome your hosts, Doctors Bagley and Schurger.
Welcome, folks, to The Blonde and the Bald. I'm Dr. Frederick Schurger.
I'm Dr. Beth Bagley, and I've got a special guest with me. It
Hey.
is Almost Dr. Beth Ladd. Double Beths.
Yes, they are Beth over there.
We are Beth. We are
So
both Beth.
so Dr. Ladd. This will come out in July. So when you graduate, what?
December this year.
December. So you've got a little bit of time there with Dr. Bagley yet. But I hear you've got a great story. So let's get into that.
Yeah. So I started to come to Precision Chiropractic March 2020 when everything started to fall apart. So I actually lost my job and got Bell's palsy in the same week. So Bell's palsy is when half of your face goes numb pretty much. You lose control over all your movements. And luckily I'd actually known somebody in the past that had Bell's palsy, and I knew how to do the stroke test. So I'm like, okay, I'm not having a stroke, but something is seriously wrong. So I made an appointment with my primary physician, went and got the medications they typically prescribe, but thankfully my mother was like, no, that's not enough. We're going to find something else. And she found Dr. Bagley's office. So that's how I learned about upper cervical care and started coming here. And I saw just a ridiculous amount of improvement. Within 6 weeks, I was almost nearly healed from Bell's palsy. And a lot of people take like 3 months to see what I saw. So I definitely saw the results of upper cervical chiropractic in that recovery. It was a blessing, really.
That's
Did
amazing.
you see other changes too? I don't remember, like with other things that you had going on.
I definitely saw an improvement with like my menstruation. That became more regular. And then I also felt like I had more energy.
Sure. Now, so I'm going to ask a couple of things. So with the bells, do you still have any problems with that, or do you have any muscles that aren't moving the way they're supposed to? Have you noticed that?
So I feel like there's a little bit of weakness still left,
Sure.
like with my eyebrow, but I definitely feel it when I get stressed.
Sure.
So especially with chiropractic school, I felt some stress with that, and I would feel like a weakness here and here that may not always was like seen by other people, but I could feel it. And there were times actually people told me, oh yeah, that eyebrow looks kind of low. But on a day-to-day basis, I typically don't have any issues. The only other thing is I now have what I call Bell's headaches. So I never had like one-sided headaches. They were always like the neck pain and everything like that. And now every once in a while I'll get a headache where it's just the right side of my face, and that's the same side that I was affected by with Bell's.
That is interesting. All right. So here's the other question that seems like you glossed over. It's like, yeah, I had problems. You had problems with your cycle, but how bad? What was it bad beforehand? Did you even know that there was a problem with your cycle?
So, yeah, I've had issues since I was like 18,
Sure.
even maybe 17. But I'd gone on the pill previously. That kind of got regulated, and then I had recently gone off the pill prior to coming here. And I was kind of like going through the ups and downs of coming off of that hormone medication. So, and then with the Bells, actually prior to that, what I what I attribute that to, is that about, and I didn't realize this till later, but about a month, I want to say about a month or month and a half, before I got Bell's, I'd been working in a warehouse and I had a box fall on top of my head. And it wasn't like falling from, 10 feet up. It just kind of slid off another box and just landed on top of my head. And after that, and I didn't associate it with this, but like after that, I had some neck pain. And then just as the time went by, it just got kind of worse and worse. Until the week before I got Bell's, I'm like, man, I can't deal with this. Like, I gotta figure something out. And ended up going to a different chiropractor, just a general chiropractor. And he did a couple adjustments, and then I got Bell's. So
interesting. And the reason I asked specifically is there's so many people, and one of the comments I've heard is, and I'm certain you have too, especially in your short time as being on, not only being around Dr. Bagley's office, but also treating patients, that you've heard. It's like, is this normal? What's normal? Yeah. People are like, oh yeah, what I was, dealing with was normal. And it's like, no, it wasn't. Welcome. And then people start complaining, doc, it hurts again. And I'm like, yeah, now you can feel it. So
actually she has she started seeing some of her own new patients, and something similar happened where something started coming back. Tell them about the new patient that you saw.
So I have a patient that has ulcerative colitis. She deals with some energy issues, especially, but just her main concern was how frequent she has to use the restroom. It even makes her nervous, like going places. She has to make sure that they have 2 bathrooms, because she doesn't feel comfortable going anywhere that doesn't have 2 bathrooms, because she's worried about the emergency situation. So she came in, she had gotten upper cervical care before, but hadn't had it in a while. Hadn't had Blair. And so she has been coming in for about a month now. And about a couple weeks in, she got her normal treatment that she goes through. But then she was also getting upper cervical care along with that. And after she got her treatment and she had actually been holding a couple adjustments, she actually said that like she's been very consistent about her bathroom use and that she's had more energy. Her neck and shoulder discomfort is gone, and she's even like holding, like the last few times she's held her adjustments. So she's already seeing those improvements just in like a month.
And then today she came in and she's kind of had a dip.
Yeah. So she came in, she's like, I have been so tired. My stomach has been feeling off. And what do you know? C1 was out.
She needed to adjust.
Yeah. And there's a couple things that could be going on with that, with the average patient, where even C1 might not be out in that case, where after about 4 weeks, the body has gone through the healing process. And at somewhere around that, between weeks 4 and 6, the energy level just gets sapped down, symptoms start creeping back up, because the body is in a process of inwardly healing. And it's just like driving down a street that's going through a little bit of construction. It's just like, oh, this is going to be a pain. But you wait, after a couple of weeks, the construction's done, and now things are back to where they're supposed to be. So it's always exciting to see those kinds of cases, and it's great for anyone who has decided to go eat at your favorite restaurant that sometimes has a little bit of problems. I won't mention a certain, it rhymes with Bell. It also has Bell in the title. It might have tacos in the title. But sometimes people eat there, and sometimes, they're like, all right, I have to be, I know where I'm going right afterwards.
Yeah.
And,
why do people eat there then?
I don't understand that either. I don't eat there anymore. I don't. But it is interesting. If you've ever experienced that urgency, it is not something you want. It is. And
imagine this woman like 6-7 times a day having that kind of urgency. Like how it will consume your life.
Yes.
These digestive disorders are terrible.
Yeah, and especially your body's trying to purge something and get rid of it, and it's not. because it keeps on doing it over and over and over again. So, yeah, that's exciting that the body, that the central part of the nervous system at the brainstem, where the atlas is, that we're correcting, is now getting all of that, getting her body working the way it's supposed to. So that's awesome.
Great story.
Yeah, very much so. So, all right. Well, I guess Dr. Ladd has to, almost
She
Dr.
needs
Ladd.
to leave, so
She
we
needs
will
to leave.
reconvene in a second.
So,
Thanks for coming.
all
Thanks
right.
for having me.
Thanks for coming out. And we are back. So you just told me that before we came back that you've got a patient that needs an upright MRI.
She does.
Why do we need those? Why are chiropractors, especially us upper cervical docs, what's your thinking that why we would need an MRI, especially one of these upright ones?
So there's this thing called Chiari malformation, and essentially the cerebral or tonsils, which are these like little pieces of we call it the little brain in the back of the head, and they can fall down into this hole, the foramen magnum, which is what the brainstem comes through. So these little tonsils, these little pieces fall into it, and they're not like separated, but they kind of go in there, and then they cork things up. It's like corked. And now imagine you've got a cork, but then you lay down on your back. Well, then it just falls back into the back of your head. So if we do a traditional MRI on these people, a lot of times when they're laying down, they feel better. Like they don't have symptoms when they're laying down. Well, they don't have symptoms because they don't have the cork in, because the cork is being pulled out and it's sitting in the back of the skull. But when they sit up and they drive and they walk, whoop, the cork happens again. So if we do an upright MRI, we can actually get a diagnosis of Chiari for these people where they may not be able to get it if they're laying down.
Yep. And that's exactly what it is. And it's curious because Dr. Scott Rosa, who I'm going to show you a chapter out of his book here in a second, that anybody can access. This is probably one of the most interesting little chapters talking about the upper neck. He actually was tasked by one of his colleagues and one of his mentors to go back and look at all of these MRIs, something close to 2,000 MRIs of people who were both in upright MRs and in recumbent, laying down MRIs, and how many of them had low-lying tonsils, basically plugging the foramen magnum, and how many of them didn't, and as well as asking the question, how many of them had them in car accident, how many had car accidents and didn't. And what was interesting, so you've got these four variables playing around. And what was curious is people who had been in a car accident, these low-lying tonsils did not show up in a recumbent MRI, but did in an upright. And this article that I came across recently, Chiari, these low-lying tonsils have traditionally been something that we call idiopathic. Now, idiopathic is a wonderful word that makes doctors seem smart and regular people feel dumb, because you should know what it means. They just told you have idiopathic scoliosis or idiopathic Chiari or idiopathic diabetes. Idiopathic means we don't know where it comes from.
Yep.
Idiopathic, it is generally assumed that it was some sort of childhood thing. But what they're now suggesting is that you can have instability of the atlantoaxial joint or the atlanto-occipital joint. So basically the area above and below the atlas can be influenced by, or it can influence and pull down on that on those Chiari or on those tonsils, causing a Chiari malformation, which prevents your cerebral spinal fluid flow from flowing in and out of your brain the way it's supposed to.
Now, question is,
yes.
If this is true, I almost think we need to rename it because it's not necessarily a malformation anymore.
Well, and I think that would be accurate. I think that would be very accurate.
It's almost like a traumatic.
Yes, because what they're suggesting by taking a look at these Chiaris, and what we're finding is, and some, in this article, it actually does point out that the grade doesn't matter. yes, they go up to the grade 3, and that's depending upon how long they are. But again, it's implying that something was malformed, that wasn't formed properly, and then they became elongated. The reality is that they didn't become elongated; they got pulled down out. Nerve tissue is curious because it can bend and change and adapt some, but what's more specific is that any amount of this dropping of the cerebral spinal, or of the cerebellar tonsils into that foramen magnum actually causes basically a restriction of CSF flow, and that starts causing other problems.
Yep.
And again, this is a great little paper. What I found curious, because
it's for people who aren't looking at it, could you read the name of the paper?
So the name of the paper is A New Hypothesis for the Pathophysiology of Symptomatic Adult Chiari Malformation Type 1.
And you found that on NCBI.
Yeah. It's out of Medical Hypotheses.
Okay.
I enjoy medical hypotheses because they do a lot of good thinking and ideas anytime that I've come across them. But specifically, abnormal atlantal occipital or atlantal axial joint morphology leads to chronic cervical instability, often subclinical, which is what we do, in a large portion of these CMI. CMI stands for Chiari malformation type 1 patients. And this is what we see. We see these a lot. And then further on down, this hypothesis explains how the combination of craniocervical bony abnormalities, anatomic CSF restriction, and reduced compliance leads to symptoms in an adult Chiari patient. You had a question before that you were trying to address with me, and I have forgotten it.
Oh, but it was just about the upright MRI. Wasn't
Okay.
It?
Well, yeah, I suppose that's where we go to next.
Yeah.
Is what's going on with the upright. But I was going to make a comment for those people who don't know what this can cause. Oftentimes, it's headaches and really
Terrible
severe
headaches.
headaches.
It could also, I've seen patients with POTS also with this.
Yes. And that basically means that you sit, you go from lying to seated or even standing, either one, and you quickly decide you need to be lying again because your blood pressure can't balance out properly. Yep. So that becomes a major problem. I have a suspicion personally. I have no way to confirm this with the data that I have in front of me, but I have a suspicion it's largely a C2 problem, not that Atlas isn't involved to some lesser degree. But that's just my suspicion in dealing with some stuff. So now we are in the book Hydrocephalus, Water on the Brain, and can you see the web link here? Good.
Yeah.
I can't because it's hiding behind. You are sharing your screen.
I can see it.
Good. Any case, and if you just search Hydrocephalus, Water on the Brain book, you'll find this. Now, this book is written by, or this chapter rather, has been downloaded over 10,000 times. Hydrocephalus is one of those topics that a handful of neurologists across the country deal with it. It's not the hot button topics, but Dr. Scott Rosa and Dr. David Harshfield happen to be good friends and mentors of mine, who I've worked with over the past several years, wrote this book. And typically in a medical journal, the medical doctor gets top billing. Instead, Dr. Rosa got it because a lot of this work is what he has been doing for the past decade, looking at the atlas and the axis and how proper alignment to the occiput makes a difference.
So real quick, talk the word hydrocephalus. Define that for someone who's not medically trained.
This is why the topic or the title of the book, Water on the Brain, makes good sense, because hydrocephalus, there is a situation of hydrocephalus in young children where the actual skull will grow bigger than it's supposed to. They look like little aliens. And the reality is what has happened is they don't have proper flow of that cerebral spinal fluid. Remember, we've talked about it in the past. There are three liquids or three fluids going in and out of the brain: oxygenated blood, venous deoxygenated blood, and cerebral spinal fluid.
Mhm.
Whereas everywhere else in the body, we just have, either it's arterial blood or venous blood coming back and forth. So that cerebral spinal fluid being a third fluid, it has a certain flow pattern that's supposed to go up and down the spine,
Mhm.
out from the brain, and then it's supposed to be reabsorbed in parts of the brain and then taken out via the venous system after
And
it's
if I remember right, the movement of that system is based upon, because when your heart pumps,
yes,
your brain gets slightly bigger because
Yes.
the blood goes into the brain, and then between the pumps, so your brain is constantly going big, small, big, small, big, small. It's
Exactly.
tiny, but it's doing that.
yeah,
And
yeah.
that pumping mechanism actually helps pump the fluid around the brain, correct?
Correct. That is part and parcel to the pumping mechanism. So if you can't get the cerebral spinal fluid reabsorbed, and it would be less a matter of making too much. That would probably effectively, that's what's happening in some of these individuals. And then the brain in children, because it has not locked into place. And I will state that it's not a fusion when your skull is done forming, but rather a locking in place, because there's still a little bit of motion happening. Is it huge? No. Is it small? Absolutely. And if it's not able to do that pump, that's part of that pumping mechanism that exists. And that's why we can actually separate those bones out. Again, not an actual fusion as we become adults, but with kids, they're not even
fused at all.
connected. So they're
Yeah.
sitting out here. And if you just blow up a balloon with enough water, it actually becomes
It's-
bigger than it's supposed to be.
Yep.
It's a problem because in an adult, liquid being a non-compressible liquid, water being a non-compressible liquid, cerebral
Which is
spinal
why
fluid.
hydraulics work. Yeah.
Right, exactly. If you have too much fluid in the brain, there's no place for it to go. In the skull, rather. Too much fluid in the skull, there's no place for it to go if it's not able to go through its normal channels. And it's going to eventually start pushing, not into the skull, because it's already done that. It's going to push into the soft tissue of the brain and start causing damage of the brain. And that's, a lot of what Dr. Rosa's work has found that is suggestive normally of multiple sclerosis. He's had what looks like multiple sclerosis lesions disappear and dissipate within 30 minutes after one of his adjustments to the upper cervical, to the atlas.
That's unbelievable. That's so cool.
It is. And it begs question, what are we seeing in multiple sclerosis cases when they're presenting like this? Now, does that mean the tissue hasn't been damaged? Not necessarily, but it does suggest that the tissue can be downregulated and over time could be damaged if that pressure isn't brought back. But in any case, lots of stuff. So what I've got on the screen right now is some of these low-lying tonsils. And these are bilateral tonsillar ectopia. This large circle right here that my mouse is going around is the foramen magnum. That's your brainstem here. This is the right vertebral artery that's also causing pressure to the brainstem on here in this right picture. And then the tonsils are in there. So you got everything just jammed up.
This is the cork we were talking about.
This is exactly the cork we were talking about. So this can cause a number of symptoms and just cause any patient just horrible inability to function. I'll put it that way, because you could have vertigo, you could have the POTS as you described. This could lead to multiple sclerosis down the line.
Yeah. What about has there been a link to this kind of thing and like other neurodegenerative diseases like Parkinson's and that kind of stuff?
And that's what I was just going to say, because of the let's use Parkinson's as a great example. One of the things that they are understanding that you don't have the dopamine production. Dopamine is produced solely in the red nucleus in the brainstem. So just a little bit above where this area, the foramen magnum is. And if we go back to what I've seen from Dr. Rosa's lectures, that you have a potential that there are different spots in the brain where it's cerebral spinal fluid, something that's normally helping it be buoyant, giving it nutrients, it goes into an area of the brain and over time starts damaging that tissue. until that tissue is unable to respond and is fully damaged and, can't heal itself anymore. I would suspect the difference between a multiple sclerosis case, a Parkinson's case, and a lateral or a Lou Gehrig's, and it's ALS is the name is eluding me at the moment. But the difference between those three is just a matter of where has that cerebral spinal fluid pressure been focused.
Wow.
So, again, that's just, if I get a write an article on medical hypothesis, that's what I'm thinking. But at the very least, this does reference, and it does go back to saying, all right, the C1, C2 rotation that we're seeing right here can be enough to start causing something, some sort of instability in the upper neck has caused the brainstem to be pulled out and down while pulling those cerebellar tonsils down as well.
Yeah. And so my concern here is that, obviously there's hypothesis here. This isn't 100% proven, but we see things like this in our office and see improvement. But I also know that the longer something's been like this,
yes,
the harder it is to see improvement. So like if I have a patient who's had MS symptoms and has been diagnosed with MS for 20 years versus someone who is newly diagnosed with MS, I see a much different result with the upper cervical care that I give. I'm not saying that I wouldn't give upper cervical care to someone who has MS for 20 years. I think it's still incredibly valuable to them, but I don't expect the healing. And I'm honest with them. I don't expect a miraculous healing event to happen with them because there's been so many years of damage.
Right.
It's go ahead.
And in cases like that with MS, if they've been under, if they've had MS for 20 years, odds are good they're probably coming in either in a walker or a wheelchair.
Yep.
I'm trying to remember the doc's name out in New Jersey. It's not Dr. Pekka. It'll come to me. I'll see him at the next Blair conference and he'll give me grief that I forgot his name. But he has suggested he's seen a ton of multiple sclerosis patients over the years, even before we understood this, but we understood that we were helping these people. And one of the comments that he tells people is, what I can do is I can get you, if you're in a wheelchair, I can get you in a walker. If you're in a walker, we can get you to a cane. If you're in a cane, we can probably get you walking back to where you're supposed to be. And obviously, if you're generally healthy, we can keep it from progressing. So that's, that is probably the best way to think about it.
Yeah. And again, also telling people that that's not a promise. That's just like what he's seen.
Right.
Because everybody reacts differently, but it is pretty incredible to see these changes.
I remember when I first started our practice many years ago, I had a patient come in with MS. She was definitely in a wheelchair. And she did pretty decent for a while until she decided she didn't want to continue care. It was weird. I don't remember all the circumstances, but she actually was able to walk pretty decently without the wheelchair after we started care. Unfortunately, that didn't last long. She came in a couple more times and just didn't stick with it. And some people do that. I don't understand why, especially if you have an answer to how to fix things. But, some people are like, well, I'm going to go take the meds because I don't think it's helping enough. In fact, I had another MS patient who said, I'm just going to take the meds. I don't think we're doing anything. And I'm like, that's fine. Call me if you need me. And the next thing, she was walking. She was working full time. And then she wasn't. And last time I saw her, she's in at least a wheelchair, if not a power chair. So for those who are watching online or on video, we have this picture up here. This is your atlas right here. This is axis. This is your brainstem. And this line here is the normal line where your brainstem and spinal cord or your brainstem and your cerebellum should be above that line.
Yep.
This is when it drops below, largely because we've been suspecting that there's something that happens here in the upper neck after some trauma. It could be a car accident. It could be dove into the pool and hit wrong. It could be a number of things. Once that damage is done, it's hard to put the genie back in the bottle, as it were.
Mm-hmm.
And what we're finding is we can manage these, cases who are like this, oftentimes with really bad migraines. There's a Chiari center out of Wisconsin that regularly, depending upon the severity of the Chiaris, will first tell their patients, go see a upper cervical doctor.
Mm-hmm.
And we've shared a couple who are in that category. So
if I have a patient like this that has this and symptomatic Chiari, and they would say to me something like, well, I have to keep coming in forever. My answer to them is more probably, and people, that's one of the questions chiropractors get. I heard once you start going to a chiropractor, you have to keep going forever. And I was like, no, you don't. But when you have this kind of serious neurological damage and there's been such trauma to the upper spine, the answer is yeah. We're going to be friends for the rest of our lives.
Exactly.
If you want to stay well.
Yeah.
And it's not that I'm trying to keep, I love lifetime chiropractic patients because they choose it, but this is serious stuff. And if we can keep these people out of wheelchairs and we can keep them moving and out of most of the pain, that's incredible without having to cut the whole back of their skull off.
And quite honestly, a lot of people will get that decompression surgery. I thankfully have not seen any cases that have gone through that, but I've had colleagues who have had those people come in.
Yep.
And there's almost nothing you can do for them at this point in time. And they're worse. They invariably say, I wish I'd never done that, because they are worse off for where they were having had that decompression surgery. Yeah.
I had a teenager come in after that.
Oh.
Yeah. He didn't stick around. I mean, we tried, but, and like, we couldn't get him holding. It just was.
Yeah. And for some
and
of
it
those
really
cases,
didn't. And the truth is it didn't. He came in because he was still symptomatic after having major neurosurgery.
Right. And this, it kills you when you hear that. And it's because it's just like, we might have been able to help him beforehand.
Yep.
And certainly can't help him after. In fact, one of my regular patients, she works at the local hospital. One of her colleagues is like, I've got this headache and it's not getting better. And I've tried Botox. I think I'm just going to go do surgery. And my patient is like, why? Have you tried chiropractic? Have you gone, here, go see Dr. Schurger. He can help you. We'll see if she comes in or not. But, there's great stuff out there. You can take an injection, and these cortisol injections and some of these Botox injections will take away the pain so fast. You know what else?
They're instant. You know what else? And they get rid of wrinkles instantly too.
Yeah. You know what else takes away the pain fast? Bottle of wine. Oh, what a grand evening it will be to have a bottle of wine and no pain.
Yeah. Also morphine and.
So these things have, there's a time and a place for all of this stuff. The problem is we have to ask the question, what are we going to fix? Right. And, surgeries are not reversible. Sorry, they're just not.
No, they're not.
So the best thing you can do is get your head on straight. And if that doesn't work,
then that stuff is still there. We should be the first line of defense. So when, for someone listening out there who has never tried chiropractic, is afraid of it. First of all, if you're afraid of it, it's because you watch too much YouTube or TikTok on chiropractors adjusting people. Just know that no upper cervical doctor adjusts like that. Yeah. We are very particular and very precise in how we adjust, and we absolutely will not wrap a towel around your neck and pull your head straight out. No. That makes all of us cringe and almost want to throw up in our mouths.
Yes.
So, but don't, at least get the information before you do something so drastic as getting injections or surgery. Even Botox, which everyone's like, oh, it's no big deal. No, Botox, it's temporary. It doesn't solve anything. All it does is it just makes muscles stop working temporarily.
Yes, absolutely. All right. So I'm going to switch out of this cerebral spinal fluid Chiari mode because I think we've hit on this, and I want to talk about let's talk about the citric acid cycle.
No, my gosh, I don't want to look at that again.
What's interesting about this cycle for people who are dealing with a lot of fibromyalgia, a lot of chronic fatigue, the Ehlers-Danlos crowd, for those people who are unfamiliar with Ehlers-Danlos or however it's pronounced, it is basically a loose ligament situation. A lot of people, I suspect, a lot of people who have had an injury that will lead to a Chiari had one of two things. They either potentially had an Ehlers-Danlos situation beforehand, or they're having it afterwards.
So, but ED is genetic, correct?
Well, there is a genetic ED Ehlers-Danlos out there. Because we don't want to say ED because ED.
Well, I can say it.
Means, you can say it, but ED still implies something else in general.
We're talking.
Population.
I'm going to say. I don't want to keep saying Ehlers-Danlos. I never know how to say that one. So
anyways,
it's just weird names. But ED.
So you're going to say it for that.
EDS. How about EDS?
EDS might be better. Okay. But in any case, the question, there's actually 4 different types of Ehlers-Danlos. The first type is genetic. Oftentimes people don't live very long if they've got the full genetic. The other 3 are based off a sequela of symptoms. So there's a number of symptoms that they sort of identify to say, hey, which one of these are showing up? And the question is how much of it is an inability to properly formulate and heal ligament tissue? Because we're always replacing tissue. And if good tissue is replaced with bad tissue, that might just simply be what they're finding. But one of the interesting things about this entire group is they are just tired all the time. Their energy is just sapped. And this paper that goes into the citric acid cycle, which is all your energy and production, basically suggested that thiamine, the B vitamin, it's B vitamin 1. It was the first B vitamin. That's how they named the B vitamins. And that was number 1. That high dose thiamine is actually helpful to upregulate all of this. Now, most people, like the RDA for thiamine is only like 1 to 1.2 milligrams per day here. But this study for fibromyalgia cases said they were using anywhere from 600 to 1,800 milligrams. And they were getting, they had good results. Let's see if I can find somewhere further on down. He's got the actual, here it is. They were looking at men and women and how much to take. And basically, depending upon body weight, based in kilograms, if you were less than 60 kilograms, it was 600 milligrams. 60 to 70 was 900. And then 70 to 80 is 1,200. And over 80 kilograms for women, 1,500. Men is a little bit higher, add about 300 to those numbers. And that's where you get it. But for generally, fibromyalgia issues are hitting more women than men. So, but either case, I think this is very exciting that it might be a real simple exercise for patients to try out who are dealing with chronic fatigue. They're dealing with fibromyalgia. We help these people, but they never, chronic fatigue, fibromyalgia, and Ehlers-Danlos, on all of these cases, they still have a level of symptoms. I think, and you see if I'm in the same if you're in the same ballpark, I'd say most of those people in that category, they're living at a 7 for a pain or an intensity level of what they're at. And if I get them down to a 4 and even a 5 some days, I'm feeling, I feel like we're on the right path. But yeah, it doesn't, I've got other patients who go from a 7 or 8 on a pain or intensity scale down to a 2 after their first adjustment. About the same for you, would you say?
For sure. Absolutely. Yes.
Yeah. So it's just these cases are tricky, and trying to get them to have a higher quality of life is really what the end goal is. And just getting them to that point is hard.
Yeah.
So maybe, and this is simple. I think, I bought some of this for my wife the other day, and she hasn't seen a whole lot of change.
How long has it been though?
I mean, we're talking 3 or 4 days.
Oh, yeah.
Yeah. No, I bought it for her on Monday. She took it Monday, but she's been, we've been pushing. We've had a bunch of graduations and running around and office
And that
days.
anybody who has any chronic fatigue symptoms, that's
Yeah.
so much just to
Yeah.
do all the extra things.
Yeah, I mean, it's not uncommon that she needs just a couple of days to decompress, and she just hasn't had it. So,
Yeah.
but I'm excited by this. I think this would be something simple, really hard to overdose on a B vitamin. Your body flushes it all out.
Yes, it does.
Which
Which is why if you take a B complex, your B turns like psychedelic yellow.
Yeah. Well, no, that's because half of a lot of the B vitamins out there are crap.
Yep.
Because they are, you should get most of your vitamins from your food.
Yes.
Unfortunately, a lot of these B vitamin complexes that you're going to buy from the big bulk stores, they're made from yummy coal tar.
And they're made with they're not methylated. They're not, and I don't know. What I was trying to look up a second ago was just, is thiamine one of the ones that needs to be methylated for people to absorb it?
And quite honestly, my wife Jean's pretty on top of that because she needs a lot of that methylation stuff, because she does have that MTHFR pathway that's messed up.
Which I feel like a lot of people who have EDS probably have that too.
And it's funny because like you said, I think there's more going on, and it's just sort of figuring out what, sometimes there's one thing and sometimes there's multiple things, but there seems to be something underlying on all these cases that looks similar. And if you have a low energy production, then that could be it. But no, I don't think that this is one that needs to be
I don't think it does
methylated.
either.
No, this one does not. So,
but thiamine requires magnesium to be converted to its active form.
Right.
So it needs magnesium to make it into the TPP.
So I would definitely get some magnesium glycinate. It would be my choice for that.
I agree, because then it usually doesn't cause tummy problems.
Yeah, that's
it's better.
That would be a good one. So, but yeah, no, I think this is, like I said, for those people who are listening who are like, I got to try something, I need something. Hey, they might be too tired to even get into our offices. This might be a real simple
supplement to try out. Try it for a month and see.
Yeah. And if it's great, go buy another bottle. It's B1. It's
safe.
It's $20.
But do talk to your chiropractor or doctor before you try anything. Don't take our advice just on here. Do your own research and talk to your physicians.
That is fair. So, any case, that's what I just wanted to share that. And
I honestly I never really thought about how that could be connected, but it does make sense. And I'm excited to try that out and talk to a few patients about it.
Yep. So like I said, I think I've got three testing it out right now. We'll see. Maybe in a future episode, we'll say, oh yeah, Dr. Someone will say, yeah, Dr. Schurger had me take this B1 vitamin and now I feel great. I'm like, perfect. Sometimes you need the right vitamins to get you in the right position. So, Dr. Bagley, do we have anything else?
I think we're good. It was a great podcast. It was good to see you. We haven't talked in a few weeks.
No, I know. It's we've had too many weeks off, but this was probably nobody will notice that we had a week off, but
no, because we were ahead of schedule.
Yes.
So. One thing I will say that I wanted to talk about is how exciting it is that we've had some really excited students wanting to learn the Blair technique. And we'll be hosting a what we call Blair Primary at the end of July. But if you are a student or even a current chiropractor who wants to learn more about how to adjust precisely and safely in the upper cervical spine, if you go to, is it blairtechnique.com? Is that
blairtechnique.com?
blairtechnique.com, you can go into the events section, and there are listed all the doctors that are hosting the primary, intermediate, and advanced courses that will help you be a better doctor.
Yep. In fact, I'm excited. We will obviously talk about it after the conference. But the conference is in Las Vegas this year at the beautiful Green Valley Ranch, which is one of my favorite places. So that'll be a good time. And yes, it's, for people who are asking, I've been to a chiropractor and then he retired or she retired. And then I went to somebody else that said they do the same thing, but they didn't, and it wasn't even close. The beautiful thing about the Blair work that we do is it is very reproducible. It is very consistent from doctor to doctor. So the adjustment that I give is very much like the adjustment that Dr. Bagley gives.
Yep.
And we have trained almost Dr. Beth Ladd to do the same adjustment. And
she's
she
doing great.
does great, as we have with Dr. Shiloh. So that's the beautiful thing about this, is you are going to be slight differences from one doctor to the next, but consistently you're going to get a good adjustment that is going to get you where you need to be.
Yes.
So
Love it. Okay.
All
Where
right.
do they find you, Dr. Schurger?
I am at KeystoneChiroSBI.com, plus all the socials for Instagram, Facebook. I don't think I'm on Twitter yet. Been thinking about that, so we can post over there as well.
That would be awesome. And I am in St. Louis, Missouri. It's precisionchirostl.com. And you can find me on the socials on TikTok. I'm at Dr. Beth Bagley, I believe. And it was good to talk to you.
Yes, it was a great evening. We will talk soon, folks. Make sure you like and subscribe.
Share
it. Tell your friends and family. We try not to be completely boring.
sometimes.
Hey, have a great evening, everyone. We'll talk soon.
Bye-bye.
Bye.
That's all for today's episode of The Blonde and the Bald. Don't forget to like, share, and subscribe. If you enjoyed today's show with Drs. Bagley and Schurger, remember, don't give up and just live with the pain. Come back next week and get more answers and solutions. Visit our websites at KeystoneChiroSPI.com and PrecisionChiropracticSTL.com for more info, and catch all the episodes of The Blonde and the Bald.